Sign, sign and symptoms, cognitive symptoms, fear of dying, fear of going crazy or of losing the control, feeling of unreality, strangeness, or detachment from the self. Somatic symptoms, chest pain, dizziness, accelerated heart rate, trembling, nausea, abdominal distress, chills, feeling dizziness, feeling of losing control or dying. Diagnostic guidelines ICD-10. In this classification, a panic attack that occurs in an established phobic situation is regarded as an expression of the severity of the phobia, which should be given diagnostic precedence. Panic disorder should be the main diagnosis only in the absence of any of the phobias in F40. For a definite diagnosis, several severe attacks of autonomic anxiety should have occurred within a period of about 1 month. In circumstances where there is no objective danger, without being confined to known or predictable situations, with comparative freedom from anxiety symptoms between attacks. Although anticipatory anxiety is common, includes panic attack, panic state. DSM-5 criteria for panic disorder includes the experiencing of recurrent panic attacks with one or more attacks, followed by at least 1 month of fear of another panic attack or significant maladaptive behavior related to the attacks. Causes, genetics, major stress, temperament that is more sensitive to stress or prone to negative emotions. Risk factors, family history of panic attack, panic disorder, major life stress, traumatic event, smoking or excessive caffeine intake. Panic disorder DSM-5. Duration, 1 month of worry after one panic attack. Panic attacks occur during a discrete period. Symptoms, panic attack. Cardiopulmonary, feeling shortness of breath, palpitation, chest discomfort. Gastrointestinal, nausea or GI discomfort. Neurologic, dizziness, numbness or tingling sensation. Psychiatric, fear of losing control, fear of dying. Skin and systemic, sweating, chills. Symptoms are abrupt and unpredictable. Required number of symptoms, 4 plus symptoms, more than one attack. Differential diagnosis. Psychiatric disorders in which panic attack occur. Agoraphobia, social anxiety disorder, GAD, phobias. Substance-induced anxiety disorder, caffeine, amphetamine, cocaine intoxication. Angina, asthma, pulmonary embolism, congestive heart failure, pulmonary embolism. Treatment, non-pharmacological, psychotherapy, exposure therapy, and CBT therapy, relaxation techniques, pharmacological drugs, cognitive behavioral therapy. CBT is found to be efficacious in handling panic symptoms, cognitions, and behaviors related to panic in a short duration of 6 weeks. It is also evident that CBT brings about reliable functional change of a greater magnitude. Group therapy can often be used just an effectively to relaxation and related skill. Drug treatments, anti-anxiety drugs, benzodiazepine. Alprazolam is a drug of choice because alprazolam has antiphobic, anti-anxiety, and anti-panic property. Antidepressant, SSRI or SNRI are used. Fluoxetine is the drug of choice. Fluoxetine can also be used because it's a long-acting drug. Thank you.
I will take questions at the end of the session. You can start, Dr. Ingi. Dr. Inkle.
Good morning, sir. Good morning, everyone. Topic for today is general anxiety disorder. Anxiety is the commonest psychiatric symptom in the clinical practice and the general population.
Can you be a little loud, Dr. Inkle?
General anxiety disorder is characterized by an insidious onset in third decade and is stable and usually a chronic clinical course. What does that mean? It means it's a free-floating anxiety. It may or may not be punctuated by repeated panic attacks. There should be at least a history of 6 months in the patient, and it is actually a normal phenomenon. What does that mean? It means it becomes pathological if it causes significant subjective distress and impairment in the function of an individual. There is anticipation of danger, that is, there is no object, event, or situation. Patient would say, "Mujhe aisa lag raha hai, aisa hoga." It doesn't mean it's really going to happen. That's what actually anxiety means. Etiology, it has mainly been characterized by personality, genetics, and female is usually more than male cases. In personality, it includes temperament is timid, negative, and avoids anything that is dangerous. Talking about the pathophysiology, the major mediators are norepinephrine, serotonin, dopamine, and the GABA. There is underactivation of serotonergic neurotransmitters and overactivation of the noradrenergics. Symptoms are broadly classified into physical and the psychological. Physical undercategory has motor, which include the tremors, restlessness, and the muscle twitching. Autonomic symptoms include the palpitation, tachycardia, flushing, sweating, hyperventilation, frequency of micturition. Psychological has cognitive, where there is distractibility and poor concentration. Perceptual is the derealization. And affective is unpleasant irritability and feeling of impending doom. Features are defining it as anxiety is persistent in these patients. Their behavior is usually agitated. Associated cognition is worry, and somatic symptom is they are also persistent. The graph here shows the continuity of the symptoms. There is a static state of the continuous anxiety in these patients. Diagnostic criteria according to ICD-10, the sufferer must have primary symptoms of the anxiety most of the days for at least several weeks at a time, usually for several months. These symptoms should involve elements of apprehension, which means worries about future misfortunes, feeling on the edge, difficulty in concentration, motor tension, that is restlessness, tension headaches, and trembling. Autonomic overactivity means tachycardia, tachypnea, dry mouth, and sweating. There is transient appearance of other symptoms, which does not rule out GAD as a main cause, but it should not fulfill the criteria for other disorders like depressive episodes, phobic anxiety disorder, panic disorder, and OCDs. Now, according to ICD-10, persistent anxiety, it is characterized by shaking, muscle tension, sweating, lightheadedness, palpitation, and the GI symptoms. As described before, anxiety should not be associated with object, event, or the situation. DSM criteria, it says duration should be of at least 6 months. Symptoms are excessive anxiety, worry, difficulty controlling, managing worry. Anxiety here is characterized by restlessness, fatigue, poor concentration, irritability, muscle tension, and insomnia. The required number of symptoms first, there should be first 2 criteria plus 3 of the specific symptoms. Psychological consequences of symptom marked distress and impairment. It should not be actually a result of any other medical condition, any mental disorder, or any substance abuse. Treatment is broadly classified into psychotherapy, relaxation techniques, and the pharmacotherapy. Psychotherapy includes a cognitive behavior therapy, which is self-monitoring, relaxation technique, and focus on controlling the worry. As the table, the figure shows, understand the situation, what triggers the problem, what thoughts you're getting in the mind, what emotions you are having, what behavior you give in response to the emotions and the triggers, and what bodily sensations you're having. That is important to identify in the cognitive behavior therapy. Pharmacotherapy includes the selective serotonin reuptake inhibitors, that is SSRIs, and the benzodiazepines. To cope with the anxiety, it is easy that you understand the word aware, where it stands for accept the anxiety, watch your anxiety, act with the anxiety, and repeat the steps and expect the best. You can prevent the anxiety by following lifestyles like exercise, walk, yoga, meditate. Talk to someone about the emotions, about the feeling you get in that anxiety. Keep reading journals aware of what your trigger points are for the anxiety. Have a balanced diet. Avoid substances like drugs, caffeine, or any triggering agent. Thank you. At the end, it means that to cope with the anxiety. Thank you.
Thank, thank you, Dr. Wrinkle, Dr. Ritik. Uh, I would like to invite any questions, comments. Uh, Srinivasan, you have any questions, comments?
No, sir. No, sir.
Uh, Dr. Sanjeevni? Okay. I think both the sessions were moderated by Dr. Priya or
Sir, Dr. Ritik's session was moderated by Dr. Priya ma'am, and my session was moderated by Dr. Sanjeevni ma'am.
okay, okay, okay. So I would like to congratulate both of you in actually giving a very good presentation and in internship. I suppose that if someone would have asked me myself to give this presentation, I would have not made such good presentations. I think you stuck to the basics and job well done. We all know that there is an anxiety which is slow, free floating, not restricted to any particular situation is GAD, and episodic out of the blue anxieties, panic attacks. Then there are some classifications of panic attacks: little panic attacks, then situational predisposed panic attacks, then cue induced panic attacks. Those things also shall can be read into. uh, I think the felicitation process of certificate we can do tomorrow after tomorrow's presentation to both the interns. And I would request Dr. Priya to prepare their certificates. So thank you. Any questions, comments, Dr. Priya? You're the moderator.
So it was a very nice presentation of both of them, Sir Ritik and Ritik. And so I would like to congratulate them with the certificate. So congratulations, Dr. Ritik. Congratulations. Thank you, sir.
Thank you.